Here in this video you will watch blue waffles disease images, and also we will provide the information about blue waffle disease. Blue waffles disease is a term that describes the infection and inflammation of the vagina, which results in a bluish discoloration of the area. Blue waffles disease is a severe infection of the vagina giving rise to a foul-smelling discharge as well as a discolored vagina. Blue waffles disease is also a severe battering of the vagina by the penis or other devices, which causes it to become blue or greenish in color. Blue waffles disease is not really a medical condition involving the vagina. However, it is a term that describes the vagina when severe infections occur, such as in the case of complicated sexually transmitted diseases. Blue waffles disease is also known as blue waffles STD. How do you get blue waffles disease? Blue waffles disease can be acquired through unsafe sex and a result of various sexual transmitted diseases. Severe infection in the vagina results in an ugly appearance of the vulva with additional symptoms. It is typically seen in women who are prostitutes and engage in extreme sexual activities. People who are more at risk in developing the disease include prostitutes, women with multiple sex partners, women with previous infections in the reproductive tract, women who do not practice hygienic sex practices or parasexual practices, depression, use of unsterilized equipment when masturbating, immunocompromised women, poor perineal care. Blue waffles disease is commonly caused by a bacterial infection in the vagina. The infection usually progresses, which irritates the vagina and causes severe bruising of the area. The presence of constant irritation or sexual intercourse, despite presence of infection, causes the area to become discolored and swell severely. It may also lead to secondary fungal infections. Symptoms and signs of blue waffles disease. Discolorations in the vagina. The main symptom of blue waffles disease is the bluish discoloration of the vagina, which gave rise to the name. The discoloration results from the constant bruising of the infected vagina by a penis or other device. The presence of discoloration signifies a severe form of vaginal infection. Presence of vaginal secretions. Along with infection, there is also the presence of purulent vaginal secretions that constantly drain from the vagina. These secretions may be foul and contain bacteria, which may spread to sexual partners. Foul-smelling vagina. The presence of secretions and swelling also contributes to the presence of unpleasant odor in the vagina. Vaginal itching. Accumulation of secretions causes the vagina to become itchy. Scratching the area further aggravates the condition. Burning sensation or intense pain in the vagina. The presence of infection stimulates the inflammatory response in the area. As a result, there is pain in the area even without contact. In addition, the nerves may also be affected, leading to a burning or tingling sensation inside the vagina. Sore genitals or swelling in the vulva. The vaginal inflammation causes blood vessels to dilate and increase in the leak of fluid from the blood into the interstitial space, giving rise to swelling. Abdominal filling. The blue waffles condition may also cause intense swelling in the vulva and the pelvic area. This causes the person to feel abdominal fullness along with rectal and vaginal fullness. Some women may experience severe swelling, which makes the vagina very tense and inflamed. More severe cases also lead to tumor formations in the area and more distension. Dry skin on the vagina. Dryness of the skin around the vulva is also a result of lack of lubrication because of the affectation of the Bartholin's gland on the vaginal opening. Pain during intercourse. Swelling, inflammation, and lack of lubrication all contribute to pain during intercourse, or clinically termed as dyspareunia. Limited motions in the lower extremities and hips. The intense swelling and pain causes the person to limit movement in order to prevent aggravation of pain in the area. Diagnosis of blue waffles disease. The diagnosis of blue waffles disease is primarily done by physical examination and pelvic examination. The characteristic look of the vagina may ascertain the diagnosis. Other diagnostic tests include pelvic examination. Pelvic examination is done by looking into other organs such as the cervix and inner vagina to look for spread of the disease. Pelvic examination assesses other affectation in the pelvic organs. Thank you so much for watching my video. Please subscribe my channel for more videos. Goodbye.